Good afternoon, everybody, and thank you for joining us for another webinar in the Carey OSHA webinar series and our companion labor and employment webinar series. I can tell you that I was really hoping to not have to do this webinar. After the last couple of years going through the COVID-19 pandemic, I've got PTSD or some sort of trauma from that experience. And I really was hoping that monkeypox was not going to be COVID-19 too. And I don't think it is, but we have gotten enough inquiries from our clients and enough discussion about workplace strategies around monkeypox that we decided the time had come that we would put on this program and to start to write and think a little bit more in detail about it. So here we are today, presenting on what employers need to know about the monkeypox virus and some considerations that you could take back to the workplace today and think about strategically. Let me introduce our cast of characters today. I think many of you know probably all of us at this point, but just in case, I'm Eric Kahn. I'm one of the co-founding partners of the firm, and I chair the firm's National OSHA Workplace Safety Practice Group. I've practiced for over 20 years exclusively in the field of workplace safety and health law, with the first decade or so practicing alongside the former first general counsel of the OSHA Review Commission. I thought that being an OSHA lawyer may be pretty specialized, but over the last 2.5 years, we got even more specialized, where we were really become infectious disease OSHA defense attorneys in our practice. And along with Kara, who's joining us today, co-chaired our firm's COVID-19 task force. And so, we picked up some knowledge and experience on how to deal with infectious disease issues in the workplace. And that's why we're talking today about how that might bleed over into the latest public health crisis, the monkeypox virus. So I'm going to let Kara introduce herself and Ashley, and then we'll dig in.
Great. Thanks, Eric. Yeah. Hi, everybody. I had the privilege of starting this firm with Eric Kahn almost just about 8 years ago this month, celebrating our anniversary. And I have a very similar practice as Eric, but a different synergy with respect to the labor and employment practice. So I advise our clients, mostly employers, on really the A to Z in the employment relationship, on counseling, hiring, investigations, policies and procedures. I also am a litigator, so I defend my clients in litigation under employment-related statutes and regulations. And then really alongside Eric and the rest of our fantastic labor and employment and OSHA workplace safety team have been advising employers over the last couple of years on the various policies and procedures and what they need to know when they are communicating with their employees about the pandemic and this new public health emergency, what they can say, what they can't say. How does primarily the Americans with Disabilities Act play into it, and other paid leave or unpaid leave requirements as people need to take absences. And so that's really what it's been a large focus of our practice the last couple of years, and happy to be here presenting with Eric and Ashley on this new topic.
Thanks, Kara. Good morning, everyone, or good afternoon, everyone. I'm Ashley Mitchell, and I'm an associate here at Carey, practicing in both the workplace safety and labor and employment groups. So I have the privilege of working with both Eric and Kara. And as they've mentioned, the extensive work the firm has done as it relates to COVID-19 and infectious diseases, certainly have a lot of behind the scenes experience doing that research, reading those reports, participating in actively drafting comments for OSHA's ongoing rulemaking as it relates to COVID-19, actively reaching out to local health departments in both Spanish and English, and certainly echoing Eric's sentiments about having not wanted to have another infectious disease so quickly, but here we are and looking forward to today's webinar.
Excellent. So let's get into what we're going to cover today. I think there's an agenda a couple slides back, maybe. And so the idea today is that we'll go through a little bit of the history on, maybe there isn't an agenda, so I'll just share my view of what the agenda will be, is a little bit of historical context for what this thing is and what it isn't. And I really do think, as we get through this discussion, you'll see that this really is not a COVID-19 2. It's materially different from COVID-19 in a lot of important ways, but most important for our purposes, thinking about this as a potential workplace hazard, it's just should be much less transmissible within the workplace, and therefore implicate some of the policies and reactions and work that consumed a lot of our lives over the last couple of years on the COVID side. We continue to be hopeful that it does not become anything like that. So we'll get in some historical context. We'll get into, what are common symptoms, common modes of transmission, and what we've learned about that. We'll get into a little bit the timeline for the current worldwide outbreak, although I don't think it's being characterized as a global pandemic. It is a public health crisis of interest in a lot of countries that do not ordinarily experience outbreaks of monkeypox, including in the US. So we'll talk a little bit about what that timeline looks like generally and in the United States. And then most importantly, we'll get into employer considerations. What should we be thinking about? What should we be doing here to manage this new public health crisis? So just a couple of little historical notes. What is this thing, right? It's called monkeypox. So it invokes this animal imagery. It is a zoonotic disease, which means it's a disease that can be passed between animals and people. And it was first detected in 1958 in Central and West Africa from a colony of sick monkeys and transmitted from monkeys to humans, and apparently vice versa. But it is now something that has been around for quite a long time. It has been pretty unusual for it to creep around the rest of the world, but that has happened a couple of times in the past. But the experience that we're seeing now is probably the broadest spread we've seen of monkeypox outside of Central and West Africa in the time that we've known about this virus. The virus is in the same family of viruses that causes smallpox, and it involves similar symptoms from what you see and what we've learned and read about smallpox. But by and large, historically and in the current outbreak, those symptoms, although similar to smallpox symptoms, are much less severe generally in the case of the monkeypox virus. Similarly, I think on the next slide, we may get into this, what's understood to be effective treatments for smallpox, including the smallpox vaccine and some of the other post-infection treatments that have been known to be effective for smallpox, have been determined historically to be effective for monkeypox infections as well, because they are in the same family of virus. And I think we are learning during this current outbreak that continues to be true with the current outbreak of monkeypox. But there are limited supplies. Smallpox has not been a large global threat for a long time. So the idea of large supplies of vaccines or other treatments are not at the ready. But there are efforts underway to expand the availability and accessibility of all of that because of this outbreak we're seeing now. CDC does recommend vaccination for monkeypox in much the same way they did for COVID-19 over the last couple of years. Right now, similar to how we saw the initial rollout of the COVID-19 vaccination program, there is a prioritization of those demographics that are considered to be the highest risk of exposure, highest risk of infection. And Ashley will get into sort of how that works through, as we talked about modes of transmission. It is not a sexually transmitted disease, and Ashley will get into more detail about that. But there is, because of principally being spread through physical contact with each other, with an infected individual, that is thought right now to be the highest risk of exposure are those with multiple sexual partners. And so that is where CDC is recommending that we prioritize vaccination in the United States, at least until there are larger supplies. And maybe, I don't know that it would ever expand beyond that, but right now, that it's what the CDC is recommending. The CDC is tracking the current outbreak carefully because it is different than the historical experience that the world has had with monkeypox. It is in many more countries than it typically has been seen, and it is spreading at at levels that are very unusual in these countries where it's unusual to find it. So it has become a virus of concern to the CDC, and they're putting out information, and that's why we're starting to hear from our clients and why we're talking about this today. So I think we move on from here to Ashley talking about some of the nuts and bolts about the virus itself.
Thanks, Eric. Yeah, so as Eric mentioned, now we're going to look at the actual virus itself, starting at common signs and symptoms, and then moving forward from there. And so as we can see here, some of the common symptoms are rash and scabs, fevers, chills, swollen lymph nodes, exhaustion, muscle aches and backaches, headaches, and then respiratory symptoms. And so as we're looking at some of these common symptoms and then how and when they start, Eric and Kara will get into more detail about what that means for you as employers. But just thinking through the signs and the symptoms, they often start within 3 weeks of exposure. So as Eric mentioned, you need that close contact, that skin-on-skin exposure with an infected individual. And then after the initial infection, a person may be expected to be infectious until their skin is completely healed. And right now, the science is suggesting that takes anywhere between 2 to 4 weeks. I know we've mentioned thus far that this is not like COVID. And when we say that because this is not historically a fatal infection or a fatal disease. So, with only about 10% of folks who are in fact becoming infected requiring hospitalization and just seemingly less severe outcomes in this current outbreak. That being said, scientists continue to study the transmission of monkeypox, but to date, about 98% of the cases or confirmed cases do come from direct contact with an infectious rash, scabs, or bodily fluids. Some other means of transmission include touching items such as clothing or linens that may have touched an infectious rash or bodily fluids, respiratory droplets during prolonged face-to-face contact. So here we're thinking within 6 feet for 3 or more hours without any sort of PPE, and then respiratory droplets during intimate physical contact, such as kissing or cuddling. And so here, very different than what we have seen with COVID-19, but the science, of course, is still evolving on this particular understanding of how monkeypox is in fact transmitted. According to the World Health Organization and the CDC, right now, the science is showing that cases predominate among men that have sex with men. But as we will continue to reiterate, it is important to understand that monkeypox is not an STD. And so anyone who has direct or intimate contact with an infected individual can contract the virus, either by skin-to-skin contact, with a skin rash, or sharing respiratory droplets. Also, although monkeypox can transmit through respiratory droplets, monkeypox to date is not considered an airborne transmissible disease. And so this would also be a distinction between COVID-19. And another distinction between COVID-19 and monkeypox is the notorious pre-symptomatic spread. The current scientific thinking right now with monkeypox virus suggests that infected persons are only contagious when they are in fact symptomatic. And now just turning to the timeline of the current outbreak. So beginning in about the middle of May, the first cases that were associated with this current outbreak of monkeypox were identified in the US. And then in July of this year, the World Health Organization declaring monkeypox a public health emergency of international concern. So not quite yet at the pandemic level, just something that the World Health Organization is actively watching. And then in late July here in the US, the total cases surpassed 10,000, prompting states like New York, Illinois, California, and some local jurisdictions within those states to declare monkeypox a public health emergency. And then August 4th, the Biden administration also declaring monkeypox a public health emergency nationally, and just allowing state as well as the federal public health departments to access certain resources, certain amounts of research and public health funding. And so here we can now see, we checked as of this morning, there were 19,962 total confirmed monkeypox virus cases here in the US. And of course, it is trending upwards. And as Eric has mentioned, this monkeypox outbreak in and of itself is unique, and that prior to this year, monkeypox cases were extremely rare in the US. In cases in individuals outside of Africa where the virus commonly occurs were almost always linked to international travel. And so this is one of the first times that we are seeing cases not linked to travel in areas where monkeypox more commonly occurs. And so with that status update on monkeypox, we are turning now to considerations for employers.
So I'm going to talk about the first bullet, then hand it to Kara, because we're talking about how to deal with a potential new virus in the workplace. And so we look to our friends at OSHA, at federal OSHA, to talk about what their expectations may be from employers about this. And we're waiting still to hear what OSHA has to say about it. As of at least the end of last week, if you do a search on OSHA's website for the word monkeypox or MPV, nothing shows up. They have been completely silent about this up to this point. Although talking with some friends at the agency, I know they are working on guidance. They say it's coming soon. I heard that about 3 weeks ago, and I inquired whether that soon would be before or after the Labor Day holiday. They said soon. If you may recall, we've been waiting for an update from OSHA about COVID-19, which they haven't done. They haven't updated their guidance about COVID-19 since before the Delta variant of that virus. And we've been told since about February of this year that updated guidance would be coming soon. So I at this point, I am helpless to provide much direction for you as to what that might mean. I think this is we're more likely to see some guidance about monkeypox than we are to see updated guidance about COVID-19. I'd put them in that order. I think it's probably going to be this month, and I think it will probably be somewhat similar to the guidance we saw about COVID-19 and about SARS and other viruses like that historically. But right now, OSHA's been silent about it. That doesn't mean that there's not potential risk, potential regulatory expectations. There's obviously not a monkeypox standard, but OSHA does still have its general duty clause. And the way that it dealt with COVID-19 was to use the general duty clause as a tool to enforce other kinds of guidance, most typically CDC related guidance, but sometimes it was states, governor's mandates or public health department requirements in those states as basically as a standard marker for what would be expected from a reasonable employer. I would be very surprised to see any sort of monkeypox related enforcement before OSHA issued guidance, but they're not required to. Just in my view, it would be there would be a lack of fair notice to employers that this is something that we need to be tackling in a very serious way if OSHA's been completely silent about it. But that's not a legal judgment. That's more of a historical assessment of the way the agency operates. So right now we're operating in something of a vacuum from the OSHA standpoint, but we've learned lessons obviously over the last 2.5 years. And that's what we're going to get into for the rest of the discussion today. And I'll hand it over for Kara to lead that discussion.
Okay, thanks, Eric. Yeah, I think the reason, similarly from the employment perspective, we're not seeing anything come out yet from the EEOC, but what I do think that this is different than COVID-19 is, very quickly when COVID came into the United States in March of 22 and March 2020 and the world practically shut down, it's because it was a global pandemic. And once it became a global pandemic from the WHO, and then the United States also made it a global pandemic, that shifted the analysis of compliance under the Americans with Disabilities Act. And I'll get into that in a few minutes about what you can and cannot do. But I'm sure everyone recalls, we were able to ask people, to take their temperature. We were able to record what their temperature was in the beginning. We were able to ask them to get vaccinated. We were able to do more things because it was a direct threat analysis. Right now, because without any mention on OSHA, without any mention from the EEOC, we're back to the traditional ADA analysis in terms of inquiring about health conditions. And so right now, our recommendation is to really treat monkeypox like you would preventing spread like COVID. So implementing very similar controls that we've been doing for the last several years, including isolation, disinfecting surfaces, tools, hygiene, the distancing, and mask wearing, particularly, for those workers in, healthcare, those workers who may be exposed to, bloodborne pathogens, hospitality employees, et cetera. So be mindful of whatever you're doing now for purposes of preventing COVID-19 in the workplace. You can easily rejigger that and implement that similarly for monkeypox vaccine. As Ashley mentioned, generally right now we're finding, and the science is finding, that someone is, infectious and symptomatic for about 2 to 4 weeks. So that's where you may find people asking questions about your leave policies. Does FMLA get triggered? Are there other paid leave opportunities? Certainly, you've got similar return to work policies where you can ask for a doctor's note. That's a little bit more reasonable than COVID-19 because it's not as prevalent. Employees should be able to get a doctor's note. So think about that, incorporating, again, monkeypox in your current policies and procedures with respect to isolation, with respect to requiring them to be out of the office so they're not symptomatic, they're not passing the infection to others in the workplace, and then implementing, a solid return to work policy through your regular procedures through your doctor's note. Going to the next slide, let's talk a little bit too about your, what you're currently doing. A lot of employers are still have self-reporting policies in place, reporting your temperature, confirming that you don't have any symptoms of COVID-19. And we would recommend adding those the symptoms are similar, but adding those symptoms into, if you do have a self-reporting policy, into that policy so that people can affirm and attest that they don't have any of these symptoms when they're coming into the office. Not only for employees, but you can do that for guests, you can do it for vendors, you can do it for really any third parties that are coming in to the workplace, and making sure that people understand what the symptoms are. And this is part of the education that we'll talk about in a few minutes, making sure they understand what the symptoms are and that they can attest and make sure that they don't have those symptoms when they're coming into the office. As I mentioned previously, right? So you can inquire about someone's diagnosis and health status if they report that they have symptoms or if they report that they have been infected with monkeypox. But you need to be a little bit different about it. It can't be as extensive as during the pandemic because it needs to be business related and consistent with business need. As I said, that's the traditional method under the Americans with Disabilities Act. So just like really any other health status, any other illness, any other diagnosis with any other type of disease, that's how you want to treat your current employees with respect to the type of information that you can inquire about. Importantly, you cannot ask any applicants about whether they've been exposed to or have been diagnosed with monkeypox. That was something that you were able to do with COVID-19, and many people did implement that as part of the interview and applicant onboarding process. But because this is not during a direct threat analysis, this isn't a pandemic, that's one of the limitations that you're unable to do under the Americans with Disabilities Act. And certainly, just like with COVID-19, any information that you receive from employees about their exposure, about their symptoms, about a diagnosis, must be treated as a confidential medical file. And when it's a confidential medical file, it needs to be kept separate and apart from regular personnel files or any other regular files, and kept in a separate folder, really on a need-to-know basis. It's really going to be important that you're keeping that information limited, particularly as we're going to talk about in a few minutes, sort of some of the stereotypes and things that people are thinking about monkeypox vaccine and how you communicate with your employees about that. Before I turn it over to Eric to touch on the record-keeping reporting obligations, I do want to make sure that of top of mind when someone does report an illness and they're on isolation or recovering, that likely, even though it's not a pandemic, it's not a global pandemic, leave to recover from monkeypox or to care for a family member is likely protected leave under the Family Medical Leave Act. So we would recommend that you just assume that it will and send out the FMLA paperwork if they're going to be out for work. Could be 2 to 4 weeks. That's going to be potentially protected leave if you're a large enough employer to be covered by that law. And we also believe that it could be considered a disability. We're just running with that as we did with COVID-19, just because the definition of disability is still so broad under the revised version of the Americans with Disabilities Act. So we would just recommend that you follow your regular policies and procedures when someone requests leave, either for themselves or for a family member. Some states may have some paid leave, so you might want to follow and inquire about that. Just check your locality and your state to see if there's any potentially paid leave that could be triggered if someone requests leave. Eric, you want to chime in on record keeping?
Yeah, just real briefly. I mean, this is anybody that had a chance to talk with me about COVID-19 injury and illness record keeping knows that became a real pet peeve of mine and a mission that we have been on and continue to be on to try to get OSHA to be rational about 300 log recording and reporting obligations around COVID-19. You will recall, or hopefully will recall, that there was not a special action that had to be taken by OSHA to make COVID-19 a potentially recordable illness. It is a recordable illness if it is work-related and it triggers any of the other criteria for recording on a 300 log. There is an exception written into OSHA's 1904 record-keeping regulations, an exception for the common cold and the flu. The rationale for why those illnesses are exempt from record keeping applied, absolutely, I think applied perfectly to COVID-19, especially applicable to the Omicron variant when it became so prevalent and not quite as severe outcomes. Nevertheless, the exception was a regulatory exception. It wasn't an enforcement discretion. It wasn't a policy. The law is that if there is an illness that is transmitted at work, that is work-related, that is not expressly exempt, then it is recordable. And in this instance, right, we've seen no guidance from OSHA about this, but if there was some occasion where transmission occurred at work, it was more likely than not that a transmission occurred at work, and it might be an employee utilizing, a certain PPE, and then he shares that PPE with a coworker, and it turned out that individual was infected. There was, the virus on the shared PPE, and it transmits to a coworker. I think OSHA would expect you to find that that's a work-related illness. And if the result of that illness is days away from work, is medical treatment beyond first aid, that would be a recordable illness. So we don't need guidance from OSHA to tell us that it is. And it would be hard to imagine a scenario where OSHA issues guidance essentially exempting this from recordability. The good news is, as Ashley talked about, this should be far less transmissible in the workplace, but it is not impossible. And if it happens, and it is more likely than not that it has happened at work, then you're going to be dealing with the same challenge that we were dealing with during the COVID-19 pandemic of figuring out whether it's recordable and how to record that. But we do think that this is a potential OSHA recordable issue that we'll have to deal with. So yeah, there you go.
Great. Okay. Oh, no, one more back, please. Okay, thanks. One thing I wanted to talk to as well is some of the EEOC considerations with respect to monkeypox vaccine, right? So we want to be very cautious and mindful of discrimination or harassment issues within the workplace, since monkeypox can be spread by sexual contact. So you want to think about how you're communicating and reviewing any employee communications that you may consider. We'll talk about that in a minute, to state that, monkeypox can be contacted by anyone, regardless of sexual identity, sexual orientation, anyone, race, where they came from, national origin. We've seen that with other illnesses and other issues in the past. And so being very mindful and educating your employees about the fact that this really, can be contacted by anyone. It's not targeting a particular individual, sexual orientation, ethnic group. To buttress that point, we really want to think about if you are going to communicate about monkeypox vaccine, either use images from the CDC or other images, but try and use images showing people from diverse backgrounds and racial ethnic groups. Again, to just be mindful and educate people that this is not, there is no stigma around this contracting this disease. And then certainly remind employees of anti-discrimination policies and respond promptly to complaints, as you always would in any complaint of discrimination. So one of the things that we've been asked about, and one of the things that we've been thinking through, and one of the reasons we wanted to have this webinar, was we felt that you might want to have an employee communication. Right now, I'm probably seeing about maybe half of our employee base, client base, are considering to blast out information to their employees, and they want to do it in a way that's really educational, because as really with any public health emergency, employees are going to be confused. They might be fearful. They might not know how it's transmitted. So a lot of the things that we just talked about earlier this afternoon, how it's transmitted, where the outbreaks are occurring, how to avoid infection, what to do if they're exposed. Those are a lot of things that you can get out ahead on and really proactively educate your employees and what your company is doing about it. Again, reiterating the anti-discrimination policy leave, reiterating your return to work policy, reiterating possibly if you have a self-assessment, self-reporting assessment. So one of the things that proactively you can do is send out an employee communication to coworkers. Obviously, we want to continue to maintain confidentiality to the extent that anyone has already reported being infected, or if they're out on leave for isolation, and making sure that it's really well streamed and well thought out. So if you are going to consider an employee communication, here's some things that you might want to consider putting in that communication. So again, really taking the information we've put together for you in this presentation, we hope it's been helpful, but really information about the virus, the symptoms, and the means of transmission. That can go a huge way of really eliminating people's fears or confusion, and just educating them about how it will be transmitted and what you're doing to respond to it. Of course, good idea to instruct if anyone has symptoms of monkeypox, they should talk to their doctor. Certain localities are have vaccine clinics, so there might be opportunities to be vaccinated. Important to instruct your coworkers not to come to work if they have a confirmed case or if they experience symptoms, just as we're doing with COVID and really any other health crisis. Try and avoid skin-to-skin contact with people who have a rash that looks like monkeypox. Avoid contact with materials used by infected individuals. This is where your controls, the cleaning controls that you've implemented over the last couple of years are going to continue to be very important, making sure that you're extensively washing utensils, cups, clothing, towels, anything that you use in the workplace that someone may share with other coworkers, having really strong hygienic cleaning solutions. Same thing, always repeating, whether it's the flu, whether it's COVID, whether it's monkeypox, wash your hands often with soap and water, use an alcohol-based hand sanitizer, continue to stock that in your employee break rooms, in your bathrooms, in and around the office to make sure that people have those hand sanitizers around and they're using them. Encourage vaccination for those who have been or more likely to be exposed to monkeypox. As I said, a lot of states and localities are having vaccine clinics. While Eric mentioned that supplies are shorter, they are prioritizing certain groups and individuals and communities. And so that certainly is an area that we would encourage people to get vaccinated if they can. And then again, reminder about your sick leave policies, who can take it, who they need to contact, what information they need to share. And if you have any specific return to work policies, a doctor's note, making sure that that is clear. And certainly if there's FMLA leave available, if there's paid leave available, you want to make sure that employees are mindful and able to use that paid leave if they have it. So with that, I'm going to turn it back to Eric, and he'll just have some closing thoughts. And this is not our traditional, webinar, so it was a really streamlined and focused webinar on this emerging topic. But we also wanted to make sure we had time for any questions that anyone may have. So with that, I'll turn it back to Eric.
Thanks. And there's one other. I didn't catch whether you covered the two types of communications that we're being asked about the most often. The one is just sort of a general communication to employees. Here that you did get into in detail. The other, go back one slide, is the situation, and this is has been an extremely challenging situation to manage with COVID-19, and that is communicating with coworkers, whether you should do it, how you should do it, what information should be conveyed if you learn about a potential exposure at work, right? So you learn that one of your employees is infected, one of your employees has tested positive, shared that information with you, and you learn about contacts that worker had at work. Should you make notifications to coworkers about potential exposures? Right now, I think there's again a total vacuum from OSHA about that. I think you can assess the risk of infection in your workplace. Do you have the kinds of contacts where infection is possible? Do you have close contacts? Do you have individuals sharing tools, sharing work clothing, sharing PPE? And if you think that there is a possibility that there is a coworker who's been infected or who's been exposed, making a communication about that is a reasonable thing to do, but you have to maintain confidentiality, just the same way we did with COVID-19. You don't identify the infected individual. You just communicate that, someone at work has a confirmed case, and you've been identified as someone who had contact with that individual at work. And again, I think the manner in which this is transmitted is different from COVID. So I don't think it's as broad a communication to everybody who might have been in the same working area, but those who had, substantial contacts, maybe physical contact, maybe group lifts, again, sharing tools, sharing equipment, things like that where there's a heightened risk. I think it would be reasonable to make those communications, but you have to do so in a careful manner. Otherwise, I think we got into everything. It was a great discussion. We'll stick around here for a little bit and answer questions if folks have questions. Otherwise, we'll flip ahead, just sort of remind everybody that we do have a couple more webinars coming up in September, one on record keeping and reporting. We're going to get into, for that one, electronic record keeping, updates to that are coming, and some interesting and nuanced issues with injury and illness record keeping and reporting to OSHA. And I know that there's a labor and employment webinar. I don't think that's happened yet in September. On the next slide, we've got something coming up there on ADA compliance for properties website. So this is an interesting subject. Kara, you can share a little about that.
Yeah, this is so for many of you that are retailers, or if you're in the hospitality industry, if you healthcare, anything that is open to the public, you are a place of public accommodation, and ADA comes into play, not on the disability discrimination angle that we've often talked about in the workplace, but disability obligations, accessibility requirements for individuals that are patronizing your store, again, your hotel, your restaurant, your hospital, what have you. But then also too, to the extent that almost everybody has an equivalent website, we have been seeing a huge influx of lawsuits against those companies for the website not being compliant. And so this webinar will go through what you need to do to make sure your website is compliant, not only for individuals with a disability who may have a visual impairment and may not be able to see and access and use e-commerce or navigate your website because of their visual impairment, but also to what additional things that if you have a particular, if a hotel or a retail space or a thing like that, what you need to make sure is on that website for accessibility compliance.
So looking at some questions, and I encourage everybody to check out our blogs. We have already started to write about monkeypox. We're continuing to track anything new and exciting that's happening on the COVID-19 front. But otherwise, we were delighted sort of earlier this year to kind of get back to our day jobs and focus on good old-fashioned OSHA issues and good old-fashioned labor and employment issues. So I encourage everybody to check out our blogs, the OSHA Defense Report, the Employer Defense Report about labor and employment issues, the Cal OSHA Defense Report about that other country out there on the West Coast that has its own special safety agency, and the Mine Safety and Health, the MSHA Defense Report covering mine safety and health issues. So we'll cover a few questions here. Oh, I don't know, Kara, if you want to talk about the credits that we've been approved for this program. You know this.
Yeah, so we've been able to get, for these and other webinars, we've been able to get continuing education credits. So if any of you are, need these for your SHRM certification or other certification, just contact our marketing manager, Teresa Green, and she can get you that information.
So I saw an interesting question about why are we talking about masks if this is not an airborne transmissible virus? Remembering the sort of progression with COVID-19, for a long time, that was not identified as an airborne transmissible virus either, but the masks were recommended because of the respiratory droplets. And the masks are being recommended still, I think, even to this day, principally as source control, unless you're in healthcare or otherwise, and you're wearing an actual respirator, right? An N95 or higher level respirator. The masks or face coverings that had been recommended were all about source control. And so our thinking right now on this front is about these controls is that it's really, if you have had a known infection or a known outbreak in your workplace, you could be considering more rigid controls. If you're in healthcare or in workplaces where there is, as Kara mentioned, common exposure to bloodborne pathogens, to pathogens in general, that it's that kind of workplace, you could consider those kinds of controls. I don't know that a general, general controls are needed in general industry workplaces. It would be expected from OSHA. I think it's certainly reasonable. It's certainly, if employees wanted to do those sorts of things, I think it would be, you should allow them to do that. And you should think about if there is a high risk factor in your workplace because of the work that you're doing, you could consider implementing those as more mandatory controls in the general course. But from a masking standpoint, it's because of respiratory droplets, and that face coverings can minimize the how far those spread and how much they spread to others that you might be interacting with face to face in the workplace. And I saw another good question about, let's see.
I saw one while you're looking for that, Eric, a question about if you're giving written notification to an employee that they may have been exposed at work, do we also need to have them quarantine for a certain number of days following their exposure? And I think that is a good idea. I mean, again, as medical science seems to indicate, someone is symptomatic after they've been exposed or infected, they're symptomatic for about 2 to 4 weeks. So that is something you want to think through. It's a shorter period, we think, than certainly COVID, but yes, that would be our recommendation, which is where those leave policies come into play. You want to think about, that because they could be symptomatic during that same period.
Yeah, and certainly, I mean, I think thinking about those policies, thinking about, and this is where it was, is it isolation for a positive case or quarantine for a potential exposure? That's the safer course to do both. The one thing that I think Ashley talked about that's a little interesting or a little bit different about monkeypox is that this is, at least right now, the present thinking is that it's transmissible during the symptomatic phase, whereas COVID was transmissible in the pre-symptomatic or even in the asymptomatic formulation. And so that's why quarantine for non-confirmed cases became such an important part of the response to COVID-19, which may be different from monkeypox. I think it would be reasonable for employers to mandate isolation for confirmed cases and to consider, make, your own judgments either way would, I think, have to be considered reasonable by OSHA about quarantine for exposures that may not have been confirmed as a positive case yet, or certainly exposures for which there's no known symptoms being experienced by the employee. This would be one where I think it would be reasonable to focus on symptoms and positive tests rather than just exposures. But the safer course we've learned through the prior pandemic is quarantine based on exposure. But even that the CDC has chipped away at that, even with COVID-19 right now. Yeah, it's a good question here about recommendations about not sharing PPE. I think that's a very good idea. And just thinking again, going back to COVID-19, I've seen citations around the country for things like not laundering shared workplace equipment and not disinfecting tools, shared tools between shifts. And that was in in the context of COVID, similar issue here. I think I remember, people had sort of cold weather gear. So they've got their regular work uniform, but they have a cold weather sort of bunker a jacket that was not laundered at the same frequency as work uniforms were. And OSHA took issue with that. I think right now, especially with this, when this really is a surface transmission, known to be a surface transmission illness, I think it would be a very good practice to either discontinue the use of shared PPE or require cleaning and disinfection between use until there's some better understanding about this virus right now. I think that would be a wise practice. You seen anything else, Kara?
Yes, someone asked a little bit about, that there are, that not mentioning that there are clear, subjectively verifiable high-risk groups, and whether that should be part of the communication. I don't think we're recommending that you shouldn't follow CDC and share what the CDC guidance are, because there are some high-risk groups. But I think as the employment lawyer in the room, and I think others would agree, we also want to be mindful of the fact that this is, regardless of high risk groups, this is a virus that anyone can contract, regardless of whether they're in the high risk group. And so in making those communications, you want to make sure you're following, the facts, that you're sharing information, directly from the CDC and other good sources, and that you're making clear that it's not sexually transmitted disease. It's not, based on sexual orientation. It's not based on, coming from Africa. It's not coming from other regions. And so you want to make sure that it can impact anybody. Anyone can catch it. And that just stems from, in your communication plans, just making sure that you're really trying to fend off any potential subjective or stigmatizing or any, harassment or other types of discrimination claims.
Yeah. There's talking about shared equipment and things like that. There's a question here about retailers with fitting rooms, and I think you could extrapolate that also to workplaces where there may be shared clothing and work clothing and things like that. What are some recommendations for dealing with that? I have talked with a lot of retailers about this, and right now I'm not aware of any major national retailers with fitting rooms that are suspending or closing their fitting rooms. I do have a few that we've talked about, communications or signage about, and I think Kara talked about this within the workplace, about communicating that if you are experiencing certain symptoms, you should stay home, you should get, see a doctor about it, seek a diagnosis about that. I think you could do something similar in your fitting rooms, that if you, are experiencing symptoms, if you have a visible rash, or going back to the slide that Ashley presented on symptoms, that, you could say, if you're experiencing any of these kinds of symptoms, please don't try on garments, please, see a doctor. If you're experiencing rash or scabs or anything like that, don't utilize the fitting room, don't try on clothes. But I don't know of any that at this point are shutting down fitting rooms. We're not recommending that. But I, continue to track where this thing goes. But I think something like that, a communication signage, tying it to symptoms would be an appropriate response. All right, well, that does this. This is probably the first webinar I've ever done that came in under the hour, and I'm sure that none of you are disappointed to hear or see that. So thank you all for joining us. I hope that this is the first and last webinar about monkeypox, but know that we'll be tracking things closely. We'll be paying attention to what the CDC says and does about this. We'll be paying attention, of course, to what OSHA and the EEOC have to say about this, and we will keep you updated if there is something material to update, and that's where following our blogs would be a good way to keep up on that. And of course, don't ever hesitate to reach out to any of us at the firm, to Kara, me, or any of our colleagues, and about this or any other OSHA or employment issues. Thanks so much for joining us.
Thanks, everybody.